And I think you also have some PowerPoint slides which you're going to show, which shows some more details of the CliniSpace experience, including patients. Let's take a look at some of those slides, and then we'll finish up.
Okay, I've just finished here and sent the patient to the ICU because she was stabilized.
So you saved her.
Yes,
yes, we have. We've saved her life. And so now then, let's look at some of these different spaces that we can have virtual patients in.
So you have multiple operating venues or medical venues. It's not just the emergency room.
Or spaces.
Right.
Multiple spaces. Here is one that is an instance, just like we showed you, with a lot of urgent care, emergency tools that you would expect to see in an emergency room. I'll go to the next one where you see a simpler environment, a caregiver standing by the bed of a patient who you saw in the last scenario, and here would be like a ward, and at the head of the bed is a sphygmomanometer. There's no oxygen supply in this room, but the simplest of tools where the patient is being cared for, like after surgery or say after a heart attack. And here is another one where there is no patient, and this would be in a clinic. And so you'd see your physician or caregiver in a clinic someplace, and here is still another environment that would look like a ward. And so a number of different kinds of spaces with different tools, different appearances, and so forth.
I might mention that we have also created military spaces, which we haven't shown here, but it's one of these gigantic military tents. I don't know what they call them, where we've taken the same medical objects we have and put them in that tent with people who are in army uniforms.
So that might be a mass casualty place where you have dozens of people being treated.
Or it could be really the people being flown in from the war front.
Or an in-field hospital. We are thinking about doing one for a helicopter, for example, to transport patients. Now, illustrated here is an intelligent medical object that we talked about, giving IV fluids in this scene. And so a number of choices that a physician or nurse knows clearly about, and the type of saline if you've chosen fluid, and if you've chosen saline, then there are a number of different amounts and volumes and rates of flow. And so these are the kinds of decisions that must be made that are predicated by the condition of the patient. And so on that goes. And so here would be a patient, and on the left side is the wall monitor of a patient, much like we saw before and took care of. And here, after they have been resuscitated and treated. And so the vital signs are much more normal here and would not create anxiety among a group of caregivers. Now, behind this model is a set of concepts about the physiology of the body. And I want to tell you a little about that because it characterizes in the simplest terms what is happening and how this changes. So based upon, in the case of hemorrhage, how much blood volume has gone down, and the blood pressure goes down, the heart rate goes up, and the oxygen saturation goes down, and the respiratory rate goes up, the patient begins exhibiting that. And here is the pregnant female we saw before, this auto injury, and the EOIS is the organ injury scale that's used around the world to describe the situation with patients. She's really bleeding rapidly, and I'm going to show you what happens to her vital signs as they develop. These are in minutes, and so you see for the first 5 or 6 minutes of heavy bleeding, the patient is able to accommodate and
compensates,
and the vessels constrict and the blood pressure is maintained, and then it begins failing and the heart rate goes up, the blood pressure goes down, etc.
Now we just have a couple of minutes left, so let me ask you this. computers in medical education, this is a field that's growing very rapidly. What do you see coming up next? What are the next developments applying computer technology to medical training?
So we really feel that this type of learning is what we would call experiential learning. It's something that's very different from the kind of factual learning that you have in a classroom. This is trying to take the real world and bring it to you in a way that's safe and you can experiment. We think that this is going to be something that every profession is going to adopt. We are doing it with medical, but there's no reason you couldn't do it in business. It's like case-based learning in business, but in immersive case-based learning.
They already have flight simulators for people who fly planes.
Absolutely, yes. It's flight simulator taken to the professional world. They are serious virtual games in a sense. And people do think that given the demographics of people who are accustomed to using this, more and more we're going to see a combination of this type of simulation in an immersive world overlaid with game-like play, where we will have collaboration and competition, and we will actually individually and as organizations interact through our learning.
Yeah. I'd love to ask more questions, but I've gotten the signal that we're just about out of time, so we are going to have to wrap the show. I'd like to thank my two very distinguished guests, Dr. LeRoy Heinrichs and Parvati Dev, co-founders of Innovation in Learning, which created CliniSpace. Thank you for watching. Visit our website, www.futuretalk.net. For Future Talk, I'm Marty Wasserman, and we'll see you next time.